Sadie Morway, and I'm a doctorate in athletic training student at Indiana State, and I'm here with my colleagues. And today we're going to be doing a demonstration of the ulnar nerve tension test. So if you guys want to introduce yourselves, and then we can get kind of rolling into the explanation of it.
My name is Matt Drescher. I am also a doctorate of athletic training student here at Indiana State University.
My name is Max Knight. I'm also a first-year doctorate of athletic training student at Indiana State.
And I'm Elena Robinson, and I'm also a student through ISU DAT program.
So Matt, would you kind of talk briefly about the ulnar nerve tension test, the technique? And then Elena, if you wouldn't mind explaining maybe when and why we would use this and what some of the goals are.
Yeah, so the tension tests in the upper limb are a sequential series of movements for the upper limb that slowly put more and more gradual tension on the nerves that run through your arm. And they're designed so that clinicians can find a more exact point at when those nerves are undergoing tension. And it would help being able to see what exercises or movements are causing pain in the upper arm specifically. This test specifically is biasing the ulnar nerve. And so as part of this exam, the main focus will be putting extra extension on the pinky to stretch that side of the arm and forearm a little bit more.
Yeah,
cool.
To go off of what Matt said, so when and why we would use this technique is basically if we suspect any pathology within the specific nerve that we're testing for, so in this case the ulnar nerve, and not just pathology within the nerve, but pathology within the mechanical interface or the tissues around the nerve. So it could be a relationship between the tissues and the nerve that could be causing the pathology. So this technique is a way for us to kind of figure out where in our motion we are experiencing certain symptoms such as numbness, tingling, maybe even a little bit of burning, pain, or resistance, and we can use that as a guide to figure out a treatment and where we would want to position the arm for the treatment that is most comfortable for the patient.
Totally. I think this test just in general helps the clinician identify hypersensitivities in a nerve tissue. So it's kind of cool in that way. So we're actually going to demonstrate this. So Max is going to do the demo here on Elena and kind of run through what you would explain to a patient and how to go about doing this test in an appropriate and safe way to kind of get the reads that you're looking for. Take it away, Max.
All right.
Make sure it's angled right.
Yep. Yep. Okay. There we go. That looks pretty good to me.
Mm-hmm.
Okay, Elena. So for this test, we're going to be testing your ulnar nerve, and we're going to see if there are any points throughout this test where you feel burning, tingling, numbness, pain, either in your shoulder, arm, elbow, wrist, and fingers. At any point through this test, if there's too much pain or too much tingling or whatever, and we can't tolerate it, just say stop, and we'll stop the test or return you to a safe position that will cause a reduction in those symptoms, or you won't feel it as much. Okay.
Gotcha.
So with this, we're going to start by, I'll have my left hand under your scapula, and basically what I'll be doing is pulling it down just a little bit to stabilize it. So with that, I'm going to take your hand, place my hand under, okay, down just a little bit. All right, so kind of throughout here at each point, I'll ask you if there are any symptoms. If there are, I want you to tell me what you're feeling. So if you're feeling burning or pain or anything, just let me know, and I'll follow up with a couple more questions if need be, okay? Okay, so just by doing this, Any symptoms?
No.
No. Okay. All right. So now I'm going to pull your arm out. Any symptoms?
No.
No. Okay. So now I'm going to externally rotate your shoulder. Any symptoms with that?
No.
Okay. Now with my pointer finger, I'm going to extend your pinky finger back. Any pain with that?
No.
Okay. Now I'm going to rotate your forearm. Any pain or symptoms of that?
No.
Okay. Now I'm going to extend your hand. Any symptoms with that?
I feel a little bit of tightness in my pinky.
In your pinky. Okay. All right. So now we're going to flex the elbow. Okay. Any pain with that or symptoms?
No.
Okay. All right. So now we're going to abduct the shoulder all the way, or as far as we can go. I was like, that's the spot. Any symptoms with that?
No. The pulling went away.
The pulling went away. Good. Okay. Now I want your right ear to touch your right shoulder. Any symptoms with that?
No.
Okay. Good. We're returning to a neutral position. There we go. How do we feel?
Feel good.
Feel good?
Yes.
All right. Awesome.
Awesome job. Great demo.
Yes. So just remember that like the terms, like, I'm going to be putting my hand underneath your scapula. Most patients won't really know what that means, and nor will they probably really care. So if either say more like shoulder or just general terms like that, and just go with that instead. And then I think maybe the one other thing that I probably would ask if I was a real, like, in the moment kind of patient was, what do these symptoms mean if I feel them? Like, is it a bad thing? What do you, like, does that mean that I need treatment? So maybe like, not only are you going to maybe feel these symptoms, but if you do, this is what it means. And this is what we could do for it. So just kind of tying it all together, instead of just, here's the symptoms, we're going to do the test, and then that's it.
Okay.
Other than that,
Yeah,
you did a
that's
great job demonstrating.
That's great feedback. And off of what Elena said with using medical terminology, I don't think it's a bad thing, but I think you need to, if you're saying scapula, also say shoulder blade or under your arm, just so they understand. But I think that was an awesome job.
Excellent,
Wonderful.
excellent job and excellent description.
Wonderful job, guys.
All right. Thank you, guys.